incredible. That was a hot night. It was a hot night. He's got 5.
He's got 1 minute.
He's got 5.
Thank you, Brother Ross, for that 1 minute introduction. Thank you to the Crohn's and Colitis Foundation for sponsoring and organizing this wonderful event. I'd like to thank my colleagues, my friends, and especially my family who are here tonight. I'd especially like to point out my brother Barry. I think Barry's probably the only person here over 50 who's not had a screening colonoscopy. He's 59. He said, I don't need one. I take Metamucil every day. He said, well, if I get one, if I could get one, would it be okay if I drink beer and smoke cigars? I said, yeah, okay, that's fine. We can do that. So I thought if we did some public shaming, we might get it. I would have my mom work on it, but she's 94 and she hasn't had one either. That thing came out and said at 75 you don't have one. After 75 you don't need to have a colonoscopy. Probably, did you see the paper today? I am so grateful for this honor, and I'm truly humbled. But let's face it, GI is a pretty humbling specialty. Have you ever noticed when you tell somebody you're GI, their first response is they start laughing? You're at a party and you say, oh, what do you do? And I said, I'm a gastroenterologist. And they're like, oh, my butt. Hey, maybe you don't recognize me. Everybody here in this room who does GI, well, heard this one. Hey, if you find my head up there, don't tell my wife. Everything was normal. Are you telling me I'm a perfect asshole? I still get questions. I've been doing this since '88. I still get questions. Did you always want to do this? Why did you pick this field? Here's my favorite. Does your family know? I will tell you, when I was a second-year resident at the University of Iowa, I was doing nephrology. It was November. And as anybody knows, nephrology is a difficult field. Patients are on dialysis, they're sick, there's always something going on. Their potassium is either 1 or 7. And it was November. We had this OCD first-year fellow. It was just awful. It was a brutal month, day after day. We didn't even get a day off, and it was Thanksgiving. So I do that in November, 1986. Well, the next month I do GI. I'm like, great. So I go down to the GI clinic on Monday, and there's a bunch of guys, some fellows and staff, and they're sitting around a table, and they're all talking about farting. They're talking about farting, and they're laughing. And I thought, this is the field. Because everybody likes farting. My kids say farting is always funny, and they are right. And we do it all the time. You know, if you're in procedures, you just blame it on the patient. If you're in the clinic, you blame it on the staff. So when people say, why did you pick this field? I tell them 2 reasons. Farting, and there's money in this shit. So I've been doing this for 36 years. I started my residency fellowship in '88. I came here in '91, and I've been loved with, not from here originally, but I've never thought about leaving. But if you ask me, what are the 2 the greatest changes I've seen in my 36 years? What are the 2 greatest changes? Well, one, I'd have to say Hep C. You know, in 1990, we were using interferon 3 days a week for 6 months, and we were getting 10% cures, 10%. Now we just throw some pills at them. We say, take this for 8 to 12 weeks, and we get 95 to 97% cure. 95 to 97%. So the change in Hep C from 10% to 95%, and the 10%, the side effects are terrible. Now there's no side effects. They don't even have to finish the pills, they still get cured. The second one clearly is the biologics. Prior to 1998, we flogged our patients with steroids and mesalamine and Imuran and methotrexate and, God forbid, cyclosporin. Yeah. And in 1998, Remicade was approved for use with Crohn's disease. It was like penicillin was discovered for our field. We had something that worked. Their symptoms were better, their bleeding stopped, their scopes looked better. It was working and had fewer side effects. We got people off their steroids. But of course, it was working for about 50%. So it's been 26 years now, and we keep pushing the frontiers with the research and all the things that we've done. And now we have 8 agents available for Crohn's, and we have 11 for ulcerative colitis. And these are agents that have better effectiveness, fewer side effects, different mechanisms of action. If one doesn't work, then we can try the other. So if you had to ask me the 2 things, I would say Hep C and the biologics. Now, if you ask me, what have I learned and how to treat IBD? What can I impart to my younger colleagues? Well, we all know it's a chronic disease. We don't have a cure yet. It's not common. It's 1 to 2 in 1,000, but I bet every day I see 1 to 3 Crohn's patients either in the office or doing procedures. So although it's not common, it's chronic, and we see them all the time. And of course, the knowledge, the expertise, the experience, all those things are essential. But if I had to impart something to my younger colleagues, I would emphasize the humanity and the empathy. The importance of hope and a kind word. So, my wife, Renee, died March 10th of this year. She had breast cancer. She had triple negative breast cancer, and she tried all the therapies. We even went to Nashville to get into a trial, but they all failed. 32 months after her diagnosis, she got admitted to hospice, and she died. So, I've been on the other side of the healthcare. I've been on the receiving end. I've lived through all of the pain, and the suffering, and all the frustrations that go with it. I've been through all that. But it's given me insights, hope, and a kind word. I remember those who gave me hope, even when there was little hope. You have to have something to act. And I will remember and appreciate all the kind words. Whether it was a doctor, a nurse, a staff, a guy coming in to change your garbage. You remember those kind words. In our dictation stations at work, and Ross McHenry did this, there's a framed picture that says, people don't care how much you know until they know how much you care. People don't care how much you know until they know how much you care. So yeah, the science, and I see that every day. Every day I'm doing my dictations, that's what I see. And yes, the science is important, it's essential, we need it. I'm a scientist. But I would remind you in part, don't forget the empathy, don't forget the humanity. So thank you for this honor, I'm truly humbled. I have great hope for the future of treatment for IBD. We continue to do the research, we push the frontiers. And maybe it'll be 5 years, maybe it'll be 10 years, maybe it'll be 15 years. But someday we're going to be saying there's a 95 to 97% cure and all sorts of things. Thank you.